Well, thank you all for being here. Again, I'm John. Does anyone know what vestibular means? I'm supposed to be a specialist in vestibular. What does it mean? Someone said yes. It doesn't really matter for the lecture, but it kind of does. Vestibular is your inner ear, right? So your inner ear is part of the systems of your body that helps you with your balance. But that's not why we're here. We're talking about fall prevention. And what I want to share with you, I'm going to go through several slides. You guys have already been perusing the slides and so forth. But one thing I want you to think about, and before I say the next word, is can you all hear me? Yes. Very good. All right, if you can't hear me, I tend to walk around a lot. I don't like to be behind the podium, but I will refer to my slides as I go through these. But I want you to think about this. When it comes to preventing falls, there are facts and choices, okay? Facts and choices, right? People fall for various reasons, whether it's weakness or side effects from medication sometimes can be an issue. But a lot of it is also because of choices, right? So I want you to realize that falls are preventable because we do have the choice on how to move. So let's go ahead and go into the slides. All right. So, topics for today: problems of falling in the older adult population, why fall prevention is important. I think it's pretty self-explanatory. Common causes of falls, assessing your own fall risk. I wanted everyone to be comfortable in taking a look at oneself to see what is my fall risk. You already may have an idea. You may already have had a fall. And if you've had a fall, your risk for falling is increased, right? So, steps that you can take to prevent falls, and it's not just one thing. I'll be sharing exercises with you, but I've also told you fall prevention is a matter of choices. So there are a number of things you can do to reduce your risk for falling. Again, we'll give you exercises, and at the end we'll have time for questions and answers. So that's going to be the topics for today. And we'll start with falling, information on falling. So statistically, 1 in 3 older adults will fall each year, which makes falls the leading cause of injury-related deaths in this group. So it's pretty serious stuff. Matter of fact, when I look at some of the stats, I looked at there's one fall death occurring every 19 minutes. Someone in this country dies because of a fall every 19 minutes. There are 30 million falls a year in this country. It's a lot of falling, so it's serious. And the reason why I bring it up is I've been a therapist for 25 years, and I've seen a lot of patients for their balance. And there's a lot of denial. I'm not talking about the river in Egypt, right? A lot of denial of one's risk for falling. So while I have you here, I'm going to ask you to be thinking about myself. Right? Do I deny my risk for falling? Okay? If you do, hopefully I will illuminate some of the facts. 95% of hip fractures are caused by falling. And usually sideways, which is important later on when I give you an exercise to help strengthen up the sideways. Okay? One out of every 5 falls causes an injury, such as a broken bone or head injury. And no doubt, people will become fearful of falling, right? I call healthy respect for falling a knowledge that I'm at risk and I need to do things and be proactive. A fear of falling can be paralyzing, right? We don't want you to have a fear of falling. I want you to be able to deal with the risk of falling intelligently, using these facts, the exercises, the choices you can make. A fear of falling can actually cause more of a risk for falling because now you're not doing the exercise because you're fearful of exercising because it may make you fall, or you're fearful of going out because that might make me fall. That's not good either. That's not healthy, right? So we don't want you to be fearful. Remember, falls are preventable. Facts and choices. All right, common causes of falls are due to internal and external factors, right? So internal factors, yourself. These are things that are facts, right? Everyone in this room, I assume, is 65 or older, except for those who I know about, right? So as you get older, the fact is, there's a greater chance for losing one's balance. Fact. Medications. often very required. But with that, there are side effects that can increase your risk for falling. It's a fact. Our vision changes, our hearing changes as we get older. As our vision changes, hearing changes, that can affect our mobility and our ability to kind of maneuver through our environment. As we get older, we get weaker. Okay? Our bones get weaker. Our mind isn't as sharp. Okay? There are changes in our heart rate. We might get a little dizzy when we get up too fast from a chair, especially after eating. Right? Low blood pressure could be due to medication, or it could just be an inherent part of your makeup. Bowel and bladder function. There's an allusion to Dr. Hilsen, Dr. Linda Hilsen. She specializes in incontinence. Okay? So if you're someone who has incontinence, where you may have difficulty with holding your urine, you might run to the bathroom when you got to go. Well, when that happens, guess what? Your risk for tripping, falling increases. So again, that in itself can be a risk for fall. Risky reaching or climbing habits, climbing on a chair instead of a nice solid professional stool, right, to reach products, dishware, what have you above, okay? Foot health and footwear. Footwear, the things I see people wear in the clinic. Slippers, shoes without a counter, without a heel support. BAD, no bueno, right? Try not to move through the house in slippers that don't have good support, okay? And sleep patterns, right? A lot of us have sleep issues these days with all the stress of life. So hopefully, right, you will address that with your doctors if you have some issues with sleeping, okay? So again, these are internal factors, facts, if you will, that we have to deal with. External factors, right? These are also factual, but they're in our environment. They're outside of us, right? We have to be knowledgeable so we can choose well when it comes to reducing our fall risk due to, for example, hard or slippery surfaces. Maybe you just mop the floor and it isn't quite dry yet. Or maybe you have a small dog, like my dog. She's a bit sloppy when it comes to drinking her water, and she'll kind of drink and then kind of walk away, and there's water dripping from her mouth, right? And that makes a little bit of a puddle sometimes. So small pets can be an issue in a number of ways. The glare from a hardwood floor, or the opposite, dim lighting, right? So lighting is very important. Your vision is a very important part of your balance, and we want to make sure we have plenty of light, right? So if you don't have plenty of light, or that's a struggle for you, there are a lot of neat gadgets that are motion sensitive. You might have a motion sensitive light near the bedroom as you go to the bathroom at night or during the house, right? Other factors, clutter. A lot of people like to collect stuff, okay? They don't keep a clear path as they go through their house, right? So having good lighting, making sure the house is clutter-free is a very good means of reducing fall risk. Stairs and steps. Interesting enough about stairs and steps, they in themselves can be challenging from a physical perspective, but how many folks here wear glasses that are like bifocals or trifocals or progressive, right? Many, I'm sure, right? Have you ever noticed when you're going down a curb that's like, whoa, I get a bit of I got to do a double take because the step is not nearly as in focus, right? And there's actually been research that looked at the fall risk associated with, say, bifocals. So be very mindful of when you go downstairs, if you do have glasses with those varying prescriptions, then maybe you put them on your head, or if you have a chain, just be knowledgeable. Again, you have to make that choice. Be proactive about that, okay? Insufficient grab bars. So grab bars, I remember my dad when he was alive, one of the kindest words, he was a very kind man, but he was so thankful when I installed grab bars in his shower. It was the greatest thing. He was blind, right? So grab bars were a lifesaver for him. So if you don't have those, look into getting grab bars in those key locations, okay? Removing throw rugs, anything that you can trip on. Throw rugs are no good. Wires, cords, make sure your paths are clear. Appropriate height for the bed. Too high could be something you fall out of. Too low, you can't get out of, right? So make sure your bed is, choose furniture wisely. Toilet height, again, same thing, too low, maybe difficult to get out of. Maybe consider getting the plumber to come in and give you more of a higher seat, okay? Poor furniture placement. Some folks will surf the furniture, right? They'll walk along and they know where their furniture is, and sometimes that works out fine. If the walker is too bulky to maneuver through the house, right? So they'll furniture surf, they'll have a hand on there. So you know your house, right? You know where you could go to, right, when it comes to furniture. But when you're in an unfamiliar location, maybe a restaurant or family, you don't have that that knowledge. So be mindful of using, appropriate gait aids, walkers, canes, and so forth, right? If you do this, if you're a furniture surfer, then you need a cane, right? So again, denial, right? Don't deny that you have a potential fall risk if you're someone who recognizes that, you know what, I do kind of need to touch things, right? So keep that in mind. And finally, I mentioned animals, right? So some animals are like little couch pillows, right? Just hang out. Some are a little bit more yappy, a little more busy. So if you have a little yappy little dog and likes to run around your feet, guess what? That little dog becomes a fall risk, right? I love pets, I have them, but be mindful. And be mindful of other people's dogs, right? The neighbors, right? Or maybe the grandkids bring their dog over. So be mindful that could potentially be, right, a fall risk. So again, choices, right? Choose to safety-proof your house. You're going to get you may have already gotten it. There's a little document you can use to kind of go through the house and check things off. How's this room? Is that safe? Is this room safe? How's the lighting here? So I tend to leave the dishwasher door open, right? Because I want to stack things in as the day goes by. People have tripped over their dishwasher, okay? All right. Any questions with that at all? Does that resonate with anybody? You think about that? When I go through these lists of whether it's intrinsic, things within your own body, and things in the environment, do you see how these things could be risks, right? And do you realize that you can make choices, right? You can choose to clear the clutter, or be careful when it comes to the lighting, or recognize that if you take 4 or more prescription medications, they call it polypharmacy, the multiple effect of medication. That increases your fall risk, right? And a lot of people are on multiple medications, right? It is what it is. It's a fact, but recognize that you may have to, get up a little slower, when you get off the chair, right, or out of the bed because of the effect of medications. Okay? The purpose of today is to educate you, but also to empower you, to give you some options, okay? So I mentioned how there are a number of things you can do to reduce your fall risk, okay? But first, let's step back and think, do I have a fall risk? Well, I already mentioned that if you're 65 or older, right, there's a 33% chance that you may fall this year. Now, some of you may never fall in your life, and some may fall multiple times in a year, okay? But what's your actual fall risk, right? So again, if you have fallen, you have a risk. But are there other things we can look at? We talked about medication, but what physical things, right? Well, there are, okay? For example, this single leg stance test, which we're going to practice. Now, if you're not comfortable, this is the active part of our program, right? We have some assistance to make sure you guys are safe, okay? I'm going to demonstrate this test at first. If you're not comfortable doing it, don't do it. But if you want to try it, and you think, well, I wouldn't mind having someone next to me, we got plenty of help, okay? And if you just want to watch, of course, just watch. So single leg stance test, okay? If I can do this, right? If I can stand on one leg for 5 seconds, okay? Make sure everyone can see it. This should tell you a lot, right? I'm nice and stacked up, right? I'm in control. I've got the strength to maintain this posture. Why is it important? Well, I climb curbs, climb stairs, right? I step over the bathroom or the shower, a little threshold, okay? It's important to have that ability, okay? So for those who would like to participate, this is your chance. Have you stand up. If you don't want to participate, please stay sitting. If you want someone to stand next to you, you want to try it, we'll bring a volunteer to help out. So anyone want to try the single leg stance test? Go for it. All right. So let's get some folks up here just to kind of be around just in case, right? So what you'll do, already some of y'all are doing it, you got something solid to hold on to, right? So start with a hand on the table, okay? Now let's see how you do with, right? Okay? So hold on to your table, okay? And then lift the leg up. Okay. And if you're struggling with hold on to table, don't let go. But if you're doing a good job, go ahead and let go for 5, 4, okay? So I was just 1 second, right? So try again. So 5, let go. 5, 4, 3, 2. right? So again, let go for a bit and see how you do. 5, no? You're good. All right. So, I mean, can you see, right? Think about that. To hold a single leg stance for 5 seconds has been shown it's a challenge. But guess what? That will be an exercise later on. And just so you know, right, holding on is okay. There's nothing wrong with holding on because what you're getting is so much value in this. Just so you know, when I do this, not only do I look at my posture, I have some strengthening, right? Balance control, right? There's a lot going on here when I do that. So this is fine to hold on, okay? But eventually, as time goes by, you might find yourself being able to kind of touch and let go, touch and let go. And as you do that, your balance is getting better. Your strength is getting better. Your posture is getting better. That's going to be an exercise later on. Okay, going to take a seat. Thank you very much. I appreciate your enthusiastic participation there. That's awesome. The next one is one that I wouldn't be surprised if anyone has ever been in a physical therapy session. And I think now even doctors' offices are doing it. It's called the timed up and go test, okay? Pretty simple. All we need is a chair and some space, okay? You need about 10 feet. All right, so maybe I'm gonna count out. So 1, 2, 3, 4, 5, 6, 7, 8. Close enough, right? So what I'm gonna do is I'm gonna have a volunteer. Linda, come on up here. Linda's my patient. She's come in to see me today, and she says, John, do I have a fall risk? Well, I say, Linda, let's talk about your intrinsic risks, right? Does she take medications, right? Does she have, what is her age? What's her history, okay? What's your home like, right? Do you have pets? Is the lighting in your house well enough, right? Do you do risky behaviors? Do you climb on stools and chairs when you really shouldn't be doing? You should be getting a nice professional stool, right? And then I say to her, well, it sounds like you have some risk factors. Let's look at you from a physical perspective. So I want to have you do, I've probably had her do a single leg stance test before this, but another one that's really convenient is this timed up and go. And you can try this at home as well. We've mapped out 10 feet, okay? And the research says that if it takes me 12 seconds or more to complete this task, I'm at risk for falling, okay? So, and again, when we look at the math, the statistics, we're talking dozens of years and many studies have shown consistent. I've been a therapist for 25 years. I've been working in this area for that many years. The data is solid, right? If you have difficulty doing this task in this time, your balance is at risk, right? You're at risk for falling. So when I tell you, Linda, I'm going to say go. When I say go, you're going to stand up. You're going to walk up to this line, right? You're going to turn around. You're going to come back, and we're going to time you. You ready? Go. All right, 9 seconds. Beautiful. Does she have risk for falling? No, 9 seconds, right? That's less than 12. So what does that tell me? How's her strength? Does she have trouble rising from a chair, right? So you may not do the official timed up and go, but how about yourself? Do you have trouble rising from a chair? Well, that's an issue, right? She accelerates, she walks, she turns. Does she get dizzy, right? I don't want you to raise your hand, but some of you might get dizzy, right? If you get dizzy, that can put you at risk for falling, right? So does turning make you dizzy? Coming back, can you sit down without having to hold? Again, strength, balance, walking. I call it my stool of stability, right? 3 things we need to reduce fall risk from a physical perspective. We need strength, balance, and stability. And you're going to get that today. I'm going to give exercises for those things. Thank you, Linda. So that's the timed up and go. Exercise. So I've mentioned that there are many things you can do to reduce your risk for falling, okay? But exercise is important. Oh, yes. Question. Sure, thank you.
Going back to raising the leg, right away I got a cramp in my back of my leg.
Okay. So this gentleman said he's doing his test, and right away he gets a cramp, right? So what does that tell us, okay?
Dehydrated.
You could be dehydrated. You may need to be stretching, and actually, very nice, hydration. Do you think, does it get hot in Florida? Is it too hot? Right, it's my birthday tomorrow, right? And usually by the time my birthday rolls around, the weather's getting pretty cool. It is not cool right now. So when it's hot, what happens to us? We get dehydrated, right? Hydration is huge. I can't imagine. Matter of fact, I remember when I was working in the hospital, we had patients come in for a hip fracture, right? What was their admitting diagnosis? Dehydration. In many cases, dehydration is what got them in there. They got dizzy, they fell, they broke their hip, right? So what got them to break their hip was they were dehydrated. So hydration is huge, okay? But to get back to your question, cramping, right? So I'm giving you probably half a dozen exercises today. There's many more things you can do. And a little plug, if you're having some trouble with strength and mobility and flexibility, what have you, you may want to talk to your doctor about seeing a physical therapist, right? So after today, you will have some education on what you can do. You will have some education on how to screen yourself. And if you screen yourself and you're like, you know what? I got some problems. Well, maybe you should talk to your doctor about getting into physical therapy, right? So, a shameless plug, okay? All right, speaking of exercise. In general, right, and with the exercise I give you today, if you have pain, don't do it, but then inquire, why do I have pain? What's going on, right? Why do I cramp, right? So maybe that you do have some issues with the hydration, or maybe you need to stretch, right? So when you exercise, given my exercises today, or in general, if you're exercising your own, right, stay in a pain-free range, okay? Clothing is very important. You want comfortable clothing. You don't want tight clothing, right? You want to have clothing that won't trip you up, right? We want clothing that's going to allow us to move freely, okay? Shoes, I cannot tell you, shoes are super important, right? I already talked about how slippers with no heels, or Crocs, right? These spongy, kind of non-supportive shoes, they're not good to walk in anyhow, definitely not good to exercise in. So closed toe shoes with heels are important, right? So they should be sturdy. You can exercise. So today, right, I already noticed that some of you cannot do some of these tests because you're not comfortable. Maybe you have some pain. There are alternatives, right? We'll give you some handouts for alternatives, but there's other alternatives that you can do sitting and still work on getting stronger, okay? So we can sit, we can stand. I mentioned about, furniture. Why do we hold on, right? So there's nothing wrong with holding on while you're doing your exercises, whatever there might be today, right? So holding on is fine. You're still working on strengthening, okay? Holding on is fine, okay? How often? Ideally, we tell folks to do things about 10 times. Just start easy, right? The exercise I give you today, just do 10, okay? And if you do 10 and you're like, well, that wasn't too bad, then try 2 sets of 10, right? If that's not too bad, you give that a week or two, right? And after you've done maybe exercises for a week or two and you're like, I'm doing pretty good, I'm not getting sore, we'll try 3 sets of 10. That's about as much as I tell folks to do. 3 sets of 10, I'll be giving exercise every other day. That's a good frequency. You don't have to exercise every day. You might walk one day, do your strengthening the next day, maybe your balance the day after, and kind of cycle through that, okay? So don't overwhelm yourself with exercises. Okay? It's actually a good idea. And for those who may have been a member of a health club, you may have gotten a card, or you're someone who likes to write things down. I have a friend who puts everything in a spreadsheet, right? He tracks his progress and all these things, or we've got these apps. There's plenty of apps that can track progress, but it is encouraging to keep a log of your exercises, right? And to see the progress, the reps increasing, the weights increasing, right? The number of exercises you do increasing. It's kind of fun to see your progress, right? Encouraging. So, all right. Doing good, doing good. So, how many people have to stand up in a moment? How many have to stand up here in a little bit? How many here have to stand up? Everybody, right? If you want to go home, you're going to have to stand up, right? So, what do you need to stand up? Leg strength, good posture, balance. This first exercise is my favorite exercise. I tell you, this is my favorite for everybody. Whether you had knee surgery or balance problems or back problems, I kid you not, my favorite exercise. Why? Because everyone's got to do it, right? You got to stand up, right? We go to the bathroom, you sit on the toilet, right? You get out of the chair after watching TV, supper, what you got here, out of your car. You got to stand up. So, since everyone's got to do it, we're going to do this one, right? So, be prepared. The best way to get yourself set up for this exercise is to come to the edge of your seat, okay? There's a few things that, again, I talked about facts and choices, right? This is a choice. I tell everyone, bring your nose over your toes, right? When you go to stand up, bring your nose over your toes. So what we're all going to do is we're all going to stand up, right? So let's get ready. Right? Come to the edge of your seat, okay? Okay, and you're not standing as yet, right? So again, just come to the edge of your seat, okay? And bring your nose over your toes. And I want you to stand up. We're going to do 5 in a row. So 1, down. 2, and down. And 3, and down. And yep, if you come late to the party, you're still invited. So come on, right? So nose over toes. 4, and down. And finally 5, and down. Awesome. Guess what? You just reduced your risk for falling, right? Seriously, right? To do things once is not enough. Right? To do things more than once is what's necessary to gain strength, okay? A lot of folks, they'll say, it hurts too much, or you know what? The more you try, the less pain, honestly, right? 5 is not a lot. 5 is not a lot, okay? But of course, respect the pain, but 5 is plenty. You don't have to do 30. You don't have to do 3 sets of 10, right? Doing 5 is fantastic, okay? Key thing is, what was it? Bring your nose where?
Your toes.
Over your toes, right? I was an engineer before, so that some of those traits still kind of carry through. Physics, right? Why we learn physics, right? It's very, very important, right? Nose over toes, alignment, right? Get your body, get your weight over your center, get your center of mass lined up, makes things a lot easier, okay? All right. How was that? That wasn't bad, right? Not too bad. All right, next exercise, number 2. Front knee strengthening, okay? So this is simply enough. Just bring your leg out and kick, just like you're, right? Either you're a football player kicking a field goal, or maybe you're a rocket. Your choice, okay? But go ahead and see you kick your legs out. Now, for some, right, again, I don't want to show of hands, but some have knee pain, right? Some other issues that might affect that ability. Favorite saying in therapy. Who can guess my favorite saying in therapy? Whoever's been in therapy will hear this. Move it or lose it, right? So, if you can't do a perfect leg straight straight leg raise, don't worry. I want you to move it, right? You got to move, right? We got to move it, okay? For those who would like, I think we may have a little gift, right? A little extra gift. You guys get all kinds of goodies, okay? So sometimes, just moving it is plenty. But sometimes that's not plenty. I need something to kind of challenge me. So we're going to give you these little resistive bands, okay? What I'll show you, in fact, I'll have Linda be my volunteer again. And for those who don't see her on that side, if you can't see Linda, I'll come closer. She'll come over to you later on. So take a seat right here. So sometimes when it comes to strengthening, often enough, you have to work against something, okay? So this band is convenient, right? I'm going to put the band around her ankles, okay? Here you go, Cinderella, okay? All right, so they're around her ankles, and she's going to kick her leg out straight, okay? But sometimes that band slides up a little bit, so I'm going to do a neat little trick. I'm going to take the end of the band and twist it, okay? Now it stays on her ankle. I'm going to show the guys, everyone over here who didn't see me. Sorry, I'm off camera. Back on. So what I did is I just twisted the band and put it around her foot, right? So it doesn't slide up her leg, okay? So you're only going to get a band, and this exercise, I think, for the most part, should be doable by most folks. You don't have to use the band if you don't want to. If you do have knee pain, right, don't. But maybe it'll work up to that, okay? And again, do 5, maybe 10. Start with that. Yes?
I was using the bands the first of the year.
Right?
So they started breaking on me.
Okay.
And then the pandemic came in and I quit using them. But
Right.
I was doing it for osteoporosis
Sure.
because that's supposed to be like.
Did you enjoy using the bands?
Yes, I
Sure,
did.
yep. So her bands broke. Unfortunately, they have a life expectancy. I'm not sure what it is, but they do dry out. Don't put them in the sun. Keep them fresh. But the bands are nice. And you can probably get these online. We're going to give you some today. But as they break, I'm sure you could probably go to a local sports store and get some ones online or at the store. Huh? You're lazy? Oh, all right. Make sense? Thank you very much. Appreciate that, right? So we're strengthening our legs, right? The front of our legs. The squat, the chair squat gives the big picture, everything, right? What else do I have for you? The back of the legs, right? We want to balance things out. So I'll just show you this one, okay? So I can stand, and I'd recommend that you hold on and you bend your knees, okay? Right? That's a simple one for the back of the legs, right? Because we actually want balance in our musculature, right? We strengthen the front, we want to strengthen the back. The chair rise strengthens my glutes, my buns, right? So I'm getting a good kind of an array of exercises, right? Again, we can do those 10 times, and we can repeat that maybe a second set of time, a third set of 10 as time goes by. Exercise 4, oh, this is a good one. This is a good one. Why? All right, let's see how good our memories are. Falls, especially falls related to hip fracture. Where did people fall? In what direction did they fall? Right, sideways, right? They fell sideways. It's something in the clinic, I quite often see weakness in these hips, okay? People go to the gym, right? And they do rows and presses, and the guys want to work their biceps, right? And the girls want to work their buns and their stomach, but no one works the hips, right? You need to work the hips, okay? So this is really important for building up stability, because when I'm standing, I don't know if you can all see me, if I stand, if I'm weak, okay, in my hip, what happens to my trunk? I fell. I kind of fall over a little bit, right? So if I'm weak, okay, and I might walk like that. I may walk kind of swishy because I'm so weak, right? So strengthening in here. So guess what? We're going to stand up and practice this one. Go ahead, hold on to the table, right? So have you stand up if you want to. If you don't want to, you don't have to. You can practice at home. And if you aren't comfortable doing it, I have a plan for it's not on the screen, but I have an option. But if you're comfortable enough, hold on to your table, right? Nice solid hold, okay? Shift your weight to your right leg. Shift your weight to your right leg, and then kick your left leg out to the side a little bit. Good. Yep, and we'll do that 10 times. Anybody feeling the burn yet? Right? Already feeling the burn, right? It's about 10 of those. Let's keep it balanced. Let's go ahead and come back down and shift weight to the other leg and kick that other leg out 10 times. Again, hold on to that table. I'm okay with that. When it comes to strengthening, holding on is fine. Eventually, right, if you were comfortable, right, that's enough of those. If you were comfortable, you could let go, and guess what? You're getting 2 birds for 1 stone, so to speak. You're getting balance and strength, right? You know what, while we're here, let's go ahead and do a few little benders. If you're tired, please sit, but if you're still got some energy, go ahead and bend your knees a little bit, right? Work those hamstrings. Beautiful. Awesome. Now, you may think this is not much, but trust me, this is a lot. You're doing yourself a great service by doing these simple exercises. The research has shown us, this is beautiful. Research has shown us, all right, take a break. All right, take a break and take a seat.
Any special order you should do them, or just like?
The order I'm giving you. Yep, just like I'm giving you, yep. There's no, to answer your question, the question was, is there an order? Yep, you guys can take a seat. Yep. Is there a special order that I should go in? No, right? It's more of a convenience. The pages I've given you, if you just did those in a row, that'd be perfect. Again, 5, 10 apiece, just 1 set. As time goes by, add a second set, maybe a third set, okay? The thing I want to tell you is, I mentioned before about the stool of stability, right? Balance, strength, walking, okay? Research has shown us that we can reduce fall risk by 40% if you're doing those 3 things on a weekly basis. And really, it's for the rest of your life. The studies were done over a year's time, okay? And there have been many studies that have looked at this. And consistently, results are a 40% reduction in fall risk if you do a strengthening, balance, and walking program, right? And walking could be just around the house, okay? Those exercises I'm showing you here, I got a few more for you, right, for balance, okay? But being faithful, again, choosing, right, making good, wise choices to improve your health, okay? Calf raises, pretty self-explanatory. I won't go into too much detail on this one, but, right, raising up on my heels, okay? And I tell you what, join me, sitting, feet side by side. Let's see some calf raises, okay? There is nothing wrong with doing this sitting, okay? Very effective, okay? Yep, so bring your feet, so uncross your legs, if you don't mind. Aw. And bend your knees, right? Beautiful. Now, bring your heels up in the air. Awesome. All right, do 5 of those. 2, 3, 4, 5. Awesome, you're exercising. That's fantastic, right? Move it or you got it. All right, I love it. I love it. Very good. Toe raises. Stay where you are, don't move, right? Let's see you bring your toes up in the air, right? Bring those toes up, okay? Who in the world would think they got to strengthen their shins, right? But you need to. Why? Because if you don't, you can trip, right? You got it. You can trip, right? You don't clear that step. You don't clear the shower little wall, right? So toes, keep those toe raises going too, okay? Very important. And actually, I think sitting, it's easier at first, right? Practice in sitting, and then eventually you can work on standing. Now, what most people do, just so you can kind of see me, you'll see my body, right? What I'm doing is, I'm gonna do this, right? For my toes, standing. Most folks do this. And it puts you into a fall risk, right? So again, when you're doing those at home, hold on, if you do it standing, and even doing it 1 foot at a time is okay. Just like you tap into a song, right? Put a favorite song on and just tap, tap, tap. I'm raising my toes up, okay? Beautiful. Nothing wrong with that at whatever, okay? How are we doing so far? Are you enjoying yourself? Has it been worth it? Oh, come on. You got coffee, right? Next time, we need donuts, okay? Just kidding. Hopefully this has been good so far, right? We're getting close. All right, one-legged stand. So we've already done this as a test, okay? But this is a very important balance exercise. So what I've given you so far has been strengthening. Remember my stool, strengthen. You walked in here, so you got walking covered. We've gone through some strengthening, check. Now balance. So the test was what? One leg for how many seconds? It was 5, really, 5. 10 seconds would be great, but I'm gonna say 5, right? And to be honest with you, I don't think anyone here really could do 5 seconds really well, right? So you all need to work on that, right? Which is, I do too, okay? So, but what you'll do at home is you'll stand up, hold on to something solid, raise your leg, right? And lighten up your touch, right? Whole hand, maybe 2 fingers, it's amazing what 1 finger can do, and eventually this. You're doing wonderful because all that time you're balancing, you're posturing, right? You're working those muscles, great exercise. Probably my second favorite. My first favorite was what? Rising from a chair. Remember, nose over toes. Do those 5 reps of out of the chair. Second favorite, this. Why? You get so much for so little. It's a simple exercise, but you get so much, right? I'm working on my hips, my core muscles, right? My posture, okay? Working on that. Plus, you learn, this is important, you learn what it feels like to experience a little instability, okay? To recognize that you're gonna fall is half the battle. If I'm losing it, right? I better do something. A fall happens in 1 second, okay? So it's important to feel, what does it feel like to be unsteady, right? And to react. Very important. Falls happen, right? 30 million in a year. A lot of falls, a lot of injury, right? If you fall, right, what do? Remain calm. right? Remain calm, first and foremost. Do a check, right? If I've fallen, remain calm, stay on the ground for a few minutes, check myself, okay? If you're hurt, right, be careful, right? How many, again, you don't have to raise your hand, I don't want to, but I'm a big fan of the home alert systems, okay? I got that from my parents, and my dad, he wasn't, I tell you, interesting enough, he lost his vision, thus he's already at a fall risk, but he was a very cautious man, very careful man, in a good way, right, in a healthy way. But he had anxiety, right? I asked the person who we went with, I said, would you mind if he actually hit the button every once in a while just to talk to somebody, because mom would go out shopping, right? And they said, no, that's what's there, that's why we're here. So he'd hit the button and he would talk to someone, right? Just say, I'm alone, do you mind just talking to me for a while? My wife's, and they did. Now again, that was very nice, the service we utilized was very nice like that. But again, there's some value beyond the obvious, right? So it's important to be prepared. So the home alerts are fantastic. Okay, if again, there's different, whether affording it, I guess, is an option, but definitely a good option for you. But if you have, right, fallen, don't get up too quickly, right? You could make things worse if you don't get up properly, right? I would recommend at the very least you have a phone nearby, right? Most of us have a cell phone or the landline, but if you have a cell phone, keep it on your person so you could call someone if you do get hurt, okay? If you do fall and there's no one to help out, crawling to a sturdy chair, couch, okay, is your best option, okay? We don't want you to lay in the state that you've fallen into, right? So you gotta move. You've checked yourself out, no protruding bones, you're not bleeding. Hopefully you haven't hit your head. You got your wits about you, right? If you don't have the access to the call button or the phone, then carefully, right, make your way to a chair and get up, okay? You gotta move, you gotta choose, you gotta get moving, right? It's important. And then, of course, call 911, okay? You might think this is obvious. A lot of my patients who have told me, they'll come into the clinic and they'll say, oh yeah, I fell 2 days ago, okay? Did you call the doctor, right? No, I didn't. Why? They were embarrassed, right? They didn't want their family to find out, okay? Legitimate concerns, but you know what? You gotta get checked out, right? If you hit your head, you may have a concussion, you may have, again, the possibility of a bleed, and that could definitely manifest into something much more worse. So don't take it lightly. If you've fallen, right, let your doctor know. Obviously, if you're in dire straits, you're gonna call 911, okay? All right, so what can you do? In summary, right, what can we do, right? If you, after today's lecture, if you think to yourself, well, you know what? I struggled with that single leg stance, okay? I take medications. Yeah, I can be a bit of a risk taker. Yeah, I got Fluffy. She's a challenge to me. Maybe I'm at risk for falling. Who can I talk to? Your doctor, right? So you talk to your doctor, let her or he know about your concerns. Again, a lot of doctor's offices do the timed up and go test, right? So you have a concern, you've got some risk factors, right? Internal, external risk factors. The nurse has you do a timed up and go, and it takes you 18 seconds to complete that timed up and go. Is that good, 18 seconds? No, 12 seconds, right? 12 seconds or less, okay? So what can you do? The doctor might prescribe physical therapy, occupational therapy. They may have you speak to the pharmacist about your medications, or they would do that themselves probably. Right? Education, action, right? Again, be proactive, take action, right? We have choices, okay? Check in your eyes and your feet. Hopefully, you're seeing your eye doctor, your ophthalmologist or optometrist annually, okay? And if there are some foot problems, your podiatrist, right? So make sure you keep your feet, right, healthy, your eyes healthy. Talk to your doctor, your pharmacist about medications, about concerns. Again, fall risk that we've talked about today, okay? Exercise. Move it or lose it, right? I know I'm being redundant, but I want you to think about that because you have to. You have to make that choice, okay? So how much can we reduce our fall risk if we are doing balance, strengthening, and walking? How much? 40% I can reduce my fall risk if I do those three things. If I can reduce the risk of anything bad happening to me by 40%, am I going to do it? You betcha. You betcha, right? And making your home safer, okay? Fall risk. Again, you have a checklist, I believe. Look at that, right? Look in your room. Go room to room to room. Is it well lit? Is there clutter? Is the path clear? Do I have enough things to hold on to if I can't get my cane or my walker into the bathroom? Can I hold on to things to make sure I don't fall, okay? Do I clean up after my spills, okay? Do I have throw rugs, okay? Do I have night lights? Do I have night lights that, will activate if I walk by, okay? So, complete your home fall risk assessment, okay? So, was this enjoyable? Did you learn?
Yeah.
Okay. What questions do you have? What questions do you have about exercise or about identifying fall risks? Any questions whatsoever about that at all?
I think this is very thorough, but just as an aside, I belong to TOPS, which is a weight control group.
Mm-hmm.
I got my magazine yesterday, and it covered this very subject with all these same exercises.
Awesome. That's fantastic. So, what's your name?
Betty Burgess.
Betty. So Betty is very involved. She's proactive, right? So she gets a magazine that talks about fall risk assessments and exercises, right? So this is not new, okay? This is the take-home message. I've been a physical therapist for 25 years, specializing in balance, right? Fall reduction, okay? In 25 years, have the numbers changed? No, right? 1 in 3 adults still fall. Why is that, right? Because we're human, right? That's why I say choices. There's facts. We're getting older. We take medication. Our vision's changing. My toes aren't the same thing. My toes are numb because of whatever, right? Things that are affecting my body, right? Choices I make, we fall, right? But do you want to be that statistic, right? You don't, right? Again, one death related to a fall occurs every 19 seconds. It happens. It happens. You don't want to be that statistic, right? You can choose, right, to live a safe life, right? Check out the house. Exercise, right? Talk to your doctor about your feet, your eyes, your medications, right? Be proactive. Make the choice, okay? Thank you for bringing that, Betty. Appreciate that. Any other questions at all?